Your skin looks yellow. Over 53,000 people are expected to be diagnosed with pancreatic cancer in 2017, and 43,000 will die from it. Symptoms often aren't noticeable until the disease is in the advanced stages, but if you notice any of the following pancreatic cancer signs, talk to your doctor. Jaundice is one of the clearest symptoms of pancreatic cancer, says Christopher DiMaio, MD, a gastroenterologist at the Mount Sinai Hospital in New York City. Often, patients feel fine until one day a friend notices their eyes look yellow, then they go to the doctor and find they have advanced pancreatic cancer. Cancers that start near the head of the pancreas can block the bile duct, preventing bile from reaching the intestines, where it helps break down fats and eventually leaves the body in the stool. This bile builds up and causes jaundice, which is yellowing of the skin or eyes. It can also cause your skin to itch, according to the American Cancer Society. You experience abdominal or back pain, place the tip of your finger on the top of your abdomen, just below the breastbone. Then imagine your finger pointing straight back through your body to the spine. That's a common location that pancreatic cancer patients report feeling pain, says Dr. DiMaio. The pain is hard to describe, but a dull, internal pain in this area, or radiating around the sides of your abdomen to the back, is a tip-off and you should get it checked out, he says. Cancers that start in the body or tail of the pancreas can press on nearby organs, causing pain. If the cancer spreads to the nerves surrounding the pancreas, this can cause back pain. You have dark urine or greasy stools. If your urine starts to look dark, brown or rust-colored, this may signal a problem, as bilirubin, a substance made by the liver that partly makes up bile, builds up in the blood. Urine darkens. Clay-colored or greasy stools can also be symptoms of pancreatic cancer, as they can be caused by cancer blocking the bile duct, says Dr. DiMaio. You experience nausea or vomiting. Cancer pressing on the far end of the stomach can cause a partial blockage, making it hard for food to get through. According to the American Cancer Society, this can cause nausea, vomiting, and pain that tends to be worse after eating. All of these things, therefore, could be symptoms of pancreatic cancer. You develop pancreatitis. Unexplained or chronic pancreatitis can be caused by a small tumor on the pancreas, says Dr. DiMaio. Though pancreatitis is more commonly caused by gallstones, new medications, or alcohol abuse, if you develop the condition and don't have any of those risk factors, it could be something more serious, he says. You have poor oral hygiene. If your mouth is a mess of bad breath, inflamed gums, or loose teeth, it could be more than bad hygiene. Pancreatic cancer patients are known to be susceptible to gum disease, cavities, and poor oral health in general, according to researchers from New York University Langone Medical Center, who conducted a study examining mouth bacteria pancreatic cancer patients versus people without. They found that the presence of the same bacteria that has been tied to dental diseases like periodontitis, inflammation of the gums, put participants at a 59% greater risk of developing pancreatic cancer than those whose mouths didn't contain the bacteria. You've recently been diagnosed with type 2 diabetes. A diabetes diagnosis doesn't mean you'll get pancreatic cancer, but it is associated with an increased risk. One Mayo Clinic study found that 40% of pancreatic patients were diagnosed with diabetes in the months before their cancer diagnosis. The pancreas is responsible for creating insulin, so the early stages of a tumor may affect the pancreas's ability to produce insulin, causing diabetes, says Dr. DiMaio. You have unexplained weight loss. If you suddenly have little to no appetite, or if you're losing weight without changing your diet or exercise regimen, see your doctor. These are some of the common symptoms of pancreatic cancer, says Dr. DiMaio. Unexplained weight loss or gain is one thing that doctors themselves say you should never ignore.